Now we discuss the 5 transporting points. Stomach 45 strict exchange, Jingwell points. Stomach 45 location on the second toe, 0.1 tune from the lateral corner of the nail. How to find? Stomach 45 is located on the junction of two tangents drawn along the lateral and proximal border of the nail of the second toe, approximately 0.1 tune from the margin of the nail. Needling 0.1 tune vertically or obliquely in a proximal direction or prick to bleed. For the actions and indications, stomach 45 opens the channel and clears heat from the Yang-Min channel, LI and stomach, calms and regulates the Shen. For the special features, stomach 45 is a Jingwell point, metal point, sedation point, important distal point for all heat disorders affecting the head. For severe insomnia due to fire or phlegm heat, apply moxibustion, small fire, attracting big fire technique. This point is frequently used to calm the mind when this is disturbed in context of a stomach pattern, usually from an excess pattern, such as stomach fire being transmitted to the heart and giving rise to heart fire. The use of this point can, at the same time, sedate the stomach and calm the mind. It is often used for insomnia in this context. One particular use of this point is to clear heart fire, in which case it is used with direct moxa cones. It clears stomach heat, clears heat in the stomach channel in the face, and calms the mind and drains heart fire. The two principal actions of stomach 45 are to clear heat from the stomach channel and to a certain extent the stomach food, and to clear heat and calm the spirit. In addition, in common with all the Jingwell points, stomach 45 may be used to restore consciousness. According to the spiritual pivot, when the disease is above, select points from below. This statement emphasizes the strong action that most distal channel points have on treating disorders at the opposite end of the channel. Stomach 45 is especially indicated when Yang-Min channel heat rises to the face, nose, teeth, and lips, giving rise to such symptoms as swelling of the face, toothache, cracked lips, nosebleed, yellow nasal discharge, etc. It is also indicated for heat in the stomach food, giving rise to excessive hunger. The action of stomach 45 in clearing heat and calming the spirit is shared by many of the points of the stomach channel. This is explained both by the pathway of the stomach divergent channel to the heart and that of this primary channel, which joins with the governing vessel at DU24 and DU26. Stomach 45 also shares with the Jingwell points as a whole special ability to calm the spirit, especially in acute situations. It is indicated in the treatment of manic disorders, characterized in classic texts by indications desired to ascend to high places and sing, discards clothing, and runs around, and especially used for insomnia with excessive dreaming due to fire or phlegm heat. Its action on insomnia is shared by several of the Jingwell points of the feet. Spleen 1, kidney 1, GB44, reflecting the perception that in order to induce sleep, pathologically ascending qi, yang, or fire must be drawn downwards. In severe, intractable cases of insomnia, moxibustion may be applied to stomach 45. This technique of drawing the fire down is based on the principle small fire attracts big fire. In common with many acupuncture points, stomach 45 has a homeostatic action and may also be used for depressive disorders, characterized by withdrawal and excessive desire to sleep, thus emphasizing its ability to calm and regulate the spirit in a variety of situations. Stomach 45, where the metal aspect of the earth can be influenced, benefits the stomach official in many ways. Metal is formed within the earth and bring inspiration and quality to earth. Metal can help earth acknowledge its own harvest and be conscious of what it values. Metal help earth how the limits of its work. It distinguishes what it's meeting the needs of earth and what is over-involvement in someone else's territory. Metal, with its clear notion of boundaries represented by the body hairs on the skin, can help earth draw back to the center, weigh up the situation, and regain reason. Metal help earth have a sense of purpose. Metal, as a conductor of heat and cold, can help regulate the climate within earth and invigorate when there is inertia or inability to accept and welcome others from cold. As the sedation point, stomach 45 can calm earth if it has become agitated over emotional. The stomach meridian started near the eye and ends here on the foot, though the exit point on the way level to its young mean partner, large intestine, is at stomach 42. It traverses along territory working unceasingly with its partner, the spleen, to contribute to the maintenance of the five sang and our life. An alternative name, sick mouth, returns us to the head, near where the stomach started its meridian journey, as well as indicating one of the uses of this point, empirical point for hangover, especially with sickness. Stomach 45 calms the mind and spirit when they are disturbed by the stomach heat, which agitates the heart and causes insomnia, restlessness, and disorientation. This point can calm the heart and the stomach. As a distal point, it affects the face and clears stomach fire patterns, affecting the eyes, nose, teeth, face, stomach, and skin. Treats disorder of the mouth, dry mouth, tooth decay in the upper jaw, and cleans jaw. As Jingwell point, it can invigorate the circulation of qi and blood in the stomach meridian, affecting circulation in the feet and also the mind, improving mental dullness and congestion, as well as fullness or blockage in the body. Jingwell points provide a release for qi when it wells up from excess and are also used to release pathogens. Brightens the eye, especially when stomach heat affects the eyesight. Clears the heart of heart fire. In this instance, it is used with direct moxa cones, relieves retention of food. Thank you for your attention.
Let us now discuss Gall Bladder 40, the mound of ruins, a source Yuan point. GB40 is located in the depression anterior and inferior to the lateral malleolus, lateral to the tendons of the extensor digitorum longus muscle. How to find GB40? For easier location, ask the patient to flex their angle to the 90-degree angle from the lateral malleolus. Let the palpating finger glide into a well-defined depression anterior and inferior to the malleolus. By lifting the toes, the tendons of the extensor digitorum longus muscle, as well as the depression at GB40, will become more pronounced. For orientation, GB40 is located at the junction of a vertical line along the anterior border of the lateral malleolus and a horizontal line along its lower border. Spleen 5 is located in a comparable position, but on the medial aspect of the ankle, in the depression anterior and inferior to the medial malleolus. On a line connecting spleen 5 and GB40, liver 4 is located medial to, and stomach 41 is located lateral to the tendon of the extensor hallucis longus muscle, which runs to the big toe. Needling of GB40, 0.5 to 1.5 soon vertically or slightly obliquely in the area of the fibulotarsal ligaments towards the medial arch of the foot. Actions or indications: opens the channel, benefits the joints, spreads liver qi, clears heat and dampness from the gallbladder. Special feature, Yuan-source point. GB40 can be used to promote the smooth flow of liver qi whenever liver qi is stagnant, causing hypochondrial pain and distension and sighing. GB40 can be used to strengthen the gallbladder mental aspect, that is, the strength of character which allows one to take difficult decisions. It is also the best point to use to strengthen the gallbladder and heart in the syndrome of deficiency of the gallbladder, characterized by timidity, lack of initiative, difficulty in making decisions, and depression. On a mental level, the gallbladder channel can be used to stimulate the coming and going of the ethereal soul when the person is depressed and lacks a sense of direction and purpose in life. GB40 is the best point to stimulate this aspect of the gallbladder. To summarize, GB40 promotes the smooth flow of liver qi, so it's good for hypochondrial distension, sighing, depression, moodiness, clears gallbladder heat, swelling, redness, and pain of the eye, headache, bitter taste, and stimulates the coming and going of the ethereal soul when the person is depressed. According to Chen Shi Tu, only when the liver acquires Mingmen is it able to plan strategies. Only when the gallbladder acquires Mingmen are decisions made. The liver and gallbladder are entrusted with the ministerial fire, which corresponds to the energy of spring, growth, forcefulness, and decision-making. In this harmony, this indispensable fire is prone to flare up, principally when the liver and gallbladder lose their free-flowing function and qi stagnates and transforms to fire. The fire is drawn into the gallbladder channel as a whole and especially rises upwards to the head. GB40, the Yuan-source point of the gallbladder channel, is indicated when there is heat and stagnant qi in various portions of the gallbladder channel, giving rise to distension, pain, redness, or swelling of the head, eyes, neck, throat, axilla, and abdomen, distension and pain of the chest and lateral costal region, with sighing and inability to catch the breath and shun disorder. GB40 is also indicated when heat and dampness combine, giving rise to damp heat distressing the gallbladder fu or channel as cholecystitis and herpes zoster. If liver and gallbladder heat or damp heat transversely invade the stomach, impairing its descending function, there may be vomiting and acid regurgitation. GB40 is able to treat disorders of the lower limb as a whole and is frequently employed in combination with GB29, GB30, and GB34 in the chain and lock point association method. It is specifically indicated for hip pain, sciatica, cramping and pain of the legs, atrophy disorder, painful obstruction, especially of the ankle joint, drop foot, and flaccidity or swelling of the ankle. In the cross-needling method of point selection, the wrist joint in the upper body corresponds to the ankle joint in the lower body. And GB40 is indicated for contralateral wrist pain. According to both the spiritual pivot and the essential questions, Taiyang is the opening, Yangming is the closing, and Shaoyang is the pivot. In the differentiation of fevers, expounded in the treatise on injury by cold by Chang Chong Jing, Shaoyang syndrome represents the half-exterior, half-interior stage. The pathogenic factor resides between the Taiyang and Yangming levels, and in this sense, Shaoyang is the pivot or hinge between the exterior and interior. GB40 has long been used for chronic malaria, a classic example of a disease where the pathogenic factor enters the body and lodges at the half-exterior, half-interior level. The alternating fever and chills reflect the battle between the correct qi and the pathogenic qi. When the correct qi predominates and is able to struggle with the pathogen, there is fever. And when the pathogenic qi predominates, there are chills. GB40, the Yuan-source point of the foot Shaoyang channel, is chosen to regulate the Shaoyang channel and expel the pathogen, especially when chills predominate. Thank you for your attention.
Let's now discuss triple burner 5, or the outer pass point, a Luo-Connecting point. Triple burner 5 is located to tune proximal to the dorsal wrist joint space, or the dorsal wrist crease, between the radius and the ulna. How to find triple burner 5? As the location of the dorsal wrist crease varies, the wrist joint space should be used for orientation instead. By moving the patient's wrist in a relaxed way, the joint space becomes more easily palpable. TB5 is located to tune proximal to the midpoint of the joint space in the depression midway between the radius and the ulna. Or using the creep method, with the palpating finger, slide with slight pressure from the dorsal aspect of the wrist joint in a proximal direction between the radius and the ulna until the finger is brought to a rest at TB5 by the increasing skin bulge building in front of it. Pericardium 6 is located opposite TB5 on the anterior aspect of the forearm. TB5 is needled vertically or obliquely, 0.5 to 1.5 tune. Caution should be exercised as movement of the hand or arm during needle retention may cause bending of the needle. For its actions and indications, TB5 expels wind and benefits the head and ears, clears heat, opens and regulates the yang wei mai. It also opens the channels and alleviates pain. For special features, TB5 is the Luo-Connecting point of the triple burner meridian. It's the opening or the master point of the yang wei mai, and it is the major point for expelling wind heat and analgesic point for the upper extremity. TB5 is a major point to release the exterior and expel wind heat. It must nearly always be used to expel wind heat when there are such symptoms as fever, sore throat, slight sweating, aversion to cold, and a floating rapid pulse. It is especially indicated in invasion of external wind heat when there is an earache. It can be used for the greater yang stage of the 6 stages, which is the wind heat type, or the defensive chi level of the 4 levels, and also for the lesser yang pattern within the 6-stage pattern identification of the Gall Bladder heat pattern of the 4-level pattern identification. It is the main point to regulate the lesser yang when the pathogenic factor is half in exterior and half in interior, with such symptoms as alternation of chills and fever, irritability, hypochondrial pain, bitter taste, blurred vision, and a wiry pulse. According to some sources, this point can actually expel all pathogenic factors, that is, wind, heat, cold, dampness, dryness, and fire. This point is also a major point for the treatment of painful obstruction syndrome of the arm, shoulder, and neck, and is indeed a general point for painful obstruction syndrome from wind. As it is the connecting point, it affects the whole area irrigated by the connecting channel and the muscles and sinews along the channel. TB5 benefits the ears and can be used whenever there is an ear infection from an invasion of exterior wind heat or tinnitus and deafness from liver fire or liver yang rising. Finally, TB5 indirectly subdues liver yang rising because the triple burner connection with the gallbladder within the lesser yang, and is very much used as a distal point to treat migraine headaches on the temples from rising of liver yang. So to summarize its functions, this point expels wind heat in febrile diseases, aversion to cold, fever, earache, alternation of aversion to cold and aversion to heat. It also benefits the ears in tinnitus, deafness, earache, itching of ears, redness, pain, and swelling of the ear. It also clears heat in the head where there is redness, pain, swelling of the eyes, stiffness of the tongue, mouth ulcers, cracked lips, nosebleed, and mumps. It also subdues liver yang. There is headache, dizziness, one-sided headache, vertical headache, and neck ache. It also removes obstruction from the channel, which manifests with pain of the shoulder and neck, stiff neck, arm pain, contraction of the elbow and wrist pain, paralysis of arm, swelling and redness of arm, pain in the fingers with inability to grasp, and tremor of hand. Thank you for your attention.
We continue with the back transporting points, bladder 16, governing shoe. Location, bladder 16 is 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the 6th thoracic vertebra, T6. How to find? First, locate the spinous process of C7. From there, count down 6 spinous processes to the lower border of the spinous process of T6. Measure 1.5 tune lateral to locate bladder 16 on the highest point of the paraspinal musculature, or with the patient standing and their arms hanging down, the spinous process of T7 is level with the inferior angle of the scapula. The next spinous process in the superior direction belongs to T6. Locate bladder 16, 1.5 tune lateral to the midline. Located on the same level are do10 on the midline, a point of EXB 2.5 tune lateral to the midline, and bladder 45 3 tune lateral to the midline. Needling bladder 16, 0.5 to 1 tune obliquely towards the spine or transversely subcutaneously. Caution is pneumothorax. For the actions and indication, it unbinds the chest, regulates the chi movement in the thorax and abdomen. For the special features, bladder 16, despite its designation as back shoe point of the Dumai, this point is hardly mentioned in classical or modern texts. Bladder 16 is used mostly for stasis of blood of the heart, causing heart and chest pain. For the summary, bladder 16 regulates the heart for heart pain. It also moves chi and invigorates blood for those having epigastric pain, abdominal distension, breast abscess. Although conventionally categorized as the back shoe point of the governing vessel, it is interesting to note that bladder 16 was not discussed at all in such texts as the systematic classic of acupuncture and moxibustion, the illustrated classics of acupuncture points on the Brunsman or elucidation of the 14 channels. This downplaying of bladder 16 is reflected in other classics by the absence of any clear indication of disorders of the governing vessel, and the general paucity of indications and classical combination of this point as a whole. Its modern use is in the treatment of various skin disorders, including psoriasis, alopecia, and generalized pruritus. Here on the bladder meridian is the governing correspondence point. Domai itself runs between the parallel meridians of the bladder, and this point echoes the resonance of Dumai. Dumai is associated with yang and chi in particular. The strength of Dumai is to support us, help us be present, stay upright, and assert ourselves in the world. Larry and Ru Chat described Tai-Yang bladder and small intestine as the greatest expansion of yang and the principal hair of Dumai. Bladder 16 is a helpful point when there is symptomatology which indicates that the Dumai governing vessel, or to use an addition to Dumai points. When someone has become downtrodden in spirit, lost their sparkle and ability to shrug off the trials of life, this point can strengthen their resolve and enhance their opportunity to live their life fully, rather than a shrunken, shriveled version. High boost, its alternate name, indicates its rousing qualities. Masosha, 1989 states that it regulates the heart and invigorates the blood. Located just below the BACSHU point of the heart, the invigorating effect of DUSHU affects the area of the heart, moving stasis and thus expanding and relaxing the chest when there is pain. Benefits the diaphragm. Able to affect the heart area in this way, and given the intimate relationship of the heart with blood, it can be used to invigorate or clear heat from the blood. Hence, its use when there is skin diseases with their blood deficiency aspect, itching, or heat in the blood, boils. Regulates the chi in the chest and abdomen. It will affect the opposite region on the front of the body, and so can be used for stagnation, pain, deficiency in the upper epigastric area. Can bring an inner strength to a person when struggling with life's trial and tribulations. Thank you for your attention.
Now let's discuss the Luo-Connecting channel of the lung. So here is a very simple illustration of the Luo-Connecting channel. So from the lung 7, the Luo-Connecting channel travels to the palm and thinner eminence. After separating from the main channel at lung 7, the lung-connecting channel connects with the large intestine channel. From lung 7, a branch flows to the thinner eminence where it scatters. So let's discuss in detail the pathway of the lung Luo-Connecting channel. The lung Luo-Connecting channel system separates from the lung primary channel at lung 7 and forms a three-dimensional reticular network dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal divisions course to the interiorly-exteriorly paired large intestine primary channel. According to some schools, they travel as a transverse lung luo vessel to the Yuan-source point, to LI4. A longitudinally orientated division spreads on the palm and thinner eminence. So clinical importance of the lung Luo-Connecting channel. Excess, there will be hot and burning sensations in the palms and the wrist joints. For deficiency conditions, there will be yawning, shortness of breath, frequent urination, and enuresis. So again, the lung Luo-Connecting channel separates from the lung primary channel at lung 7, follows the lung channel into the palm, and spreads through the thinner eminence, connects with the lung channel's interiorly-exteriorly related large intestine channel. The lung channel of Han Tai Yin is interiorly-exteriorly coupled with the large intestine channel and paired with the spleen channel according to six-channel theory. The lung-large intestine relationship is further strengthened by the fact that the interior pathway of the lung primary channel descends to the large intestine fu. A branch of the lung primary channel separates from lung 7 to connect with LI1. The lung Luo-Connecting channel connects with the large intestine channel. The lung divergent channel descends to the large intestine fu and connects with the large intestine channel in the neck. It is helpful to note that the lung primary channel originates in the middle jaw in the region of the stomach. The lung primary and divergent channels ascend to the throat. The lung channel does not connect directly with the nose, but does so indirectly via the large intestine channel. The lung has 5 principal functions: governing qi and controlling respiration, controlling disseminating and descending, regulating the water passages, controlling the skin and body hair, and opening into the nose. It is by virtue of these functions that many of the actions and indications of the points of the lung channel can be explained. This can be summarized as treating rebellion of lung qi, manifesting as respiratory disorders like coughing, dyspnea, wheezing, asthma, and shortness of breath. Restoring the lungs' disseminating function when this is impaired by exterior pathogenic factors which lodge in the superficial portion of the body. Treating nasal disorders, including nosebleed and nasal obstruction. Treating disorders of the throat, such as dryness, soreness, congestion, swelling, and pain. Treating edema and obstructed urination. when this is caused by impairment of the lungs' function of regulating water passages and controlling disseminating and descending, and treating vomiting due to rebellion of stomach qi. Thank you for listening.
Let's now discuss kidney 9, or the guest house point, an accumulation or qi cleft point. Kidney 9 is located 5 tun proximal to the highest prominence of the medial malleolus, 2 tun posterior to the medial border of the tibia. How to find kidney 9? On a line connecting kidney 3, which is posterior to the medial malleolus, and kidney 10, which is in the medial aspect of the popliteal crease, measure 5 tun from the level of the prominence of the medial malleolus. Here, kidney 9 is located 2 tun posterior to the medial border of the tibia. Located on the same level, but directly posterior to the medial border of the tibia is liver 5. Kidney 9 is needled vertically 1 to 1.5 tun. Its actions and indications include clears heat and transforms phlegm. It also regulates the qi and alleviates pain. Special features: it is the qi cleft point of the Yin-Wei-Mai. Kidney 9 is an excellent point to calm the mind in cases of deep anxiety and mental restlessness deriving from kidney yin deficiency. It has a profound calming effect, and it tonifies kidney yin at the same time. It also relaxes any tension or feeling of oppression felt in the chest, often with palpitations. Because it tonifies kidney yin, calms the mind, and treats palpitation, this point is particularly indicated in the pattern of heart and kidneys not harmonized. This point is often used being the accumulation and starting point of the yin-linking vessel, with the opening points of this vessel, like pericardium 6 and spleen 4. The name of the point refers to a guest. The guest is the heart and the host, the kidneys. The name highlights the fact that this point promotes the communication between heart and kidneys. This point is used in emotional problems and anxiety affecting the heart and occurring against a background of kidney deficiency. To summarize its function, it calms the mind and opens the mind's orifices. So it's good in treating anxiety, insomnia, palpitations, manic behavior, vomiting, and of phlegm. It also tonifies kidney yin when there is backache, dizziness, tinnitus, night sweating, and dry throat. It also opens the chest when there is feeling of stuffiness under the xiphoid process, a feeling of oppression of the chest. It regulates the yin linking vessel. Kidney 9 is the qi cleft point of the yin linking vessel, which connects the yin channels of both hand and foot and the conception vessels. The yin linking vessel has a special action on the heart. Thus, the classic of difficulties says, when the yin linking vessel is diseased, heart pain will result. The traditional indication of this point do not include heart pain, but they do clearly reveal a pattern of phlegm or phlegm fire obstructing the heart, giving rise to madness, mania depression disorder, raving, fury, and cursing, and vomiting of foamy or watery saliva. Phlegm and qi coagulating in the neck region give rise to goiter, whilst tongue thrusting, where the tongue is repeatedly thrust out of the mouth like a snake's tongue, may be due to accumulated heat of the heart and spleen. This point is the opening and the qi cleft point of the Yin-Wei-Mai. Excellent point to calm the mind and spirit where there is a great anxiety and mental restlessness, as the Yin-Wei-Mai connects with all the yin meridians. It can be used for blood or yin deficiency, leading to the stress of spirit and insomnia. As it tonifies the blood, it affects the heart and chest and can be used for chest pain, stuffy chest, oppression of the chest, vague anxiety, depression, and nightmares. Because of this, it is a particularly good point when kidney and heart are not harmonized and knowledge on how to survive is undermined by exhaustion. This tonifying yet stabilizing point allows water to settle and find a level situated as it is within the belly of the calf, so it is contained and directed. It brings nourishment and stamina to help a person confront and overcome their problems. As the yin wei mai opens the chest, it can help move phlegm, blocking the orifices of the heart, causing unconscious and wild behavior. The yin wei mai also links with the ren mai, and this point is frequently used to sustain the mother through pregnancy. A Japanese tradition recommends moxa on this point in the 3rd, 6th, and 9 months of pregnancy to ensure a healthy baby. Grasping the Wind by Ellis Weisman and Boss in 1989 explains the name represents the kidney meridian hosting the yin wei mai, which is the guest. As the Sheik left point, it is also good for expelling pathogens and dispersing obstruction and swelling. Calf intestine and leg belly refer to its locations on the calf. This point calms the mind, tonifies kidney yin, opens the chest, and regulates the yin linking vessel. Thank you very much for your attention.
We continue with the 4 C's, stomach 9, man's welcome point. Stomach 9 location is 1.5 tune lateral to the anterior midline on the level of the laryngeal prominence and at the anterior border of the sternocleidomastoid muscle. How to find? From the laryngeal prominence, palpate posteriorly to the anterior border of the sternocleidomastoid muscle. Stomach 9 is located at the anterior border of the muscle, which becomes more clearly visible and palpable if the patient's head is turned in the opposite direction. Located on the same level are SI16 on the posterior border of the sternocleidomastoid muscle and LI18 between the two heads of the sternocleidomastoid muscle. Needling, if necessary, move the head to its normal position before needling. Caution, carotid artery, carotid sinus, jugular veins. The carotid artery is located directly at the anterior border of the sternocleidomastoid muscle. The needle should be inserted anterior to where you can feel the pulsating of the carotid artery. Vertically 0.5 to 1 tune between the artery and the thyroid cartilage. For reasons of safety, the artery should be held in a lateral position with one finger of the palpating hand above and one finger below the insertion site. Irritation of the carotid sinus can lead to lowering of the blood pressure and fainting. For the actions and indications, stomach 9 regulates the qi, opens the channel, harmonizes excess or deficiency in the thorax. For the special features, it is the window of heaven point, C of chi point, meeting point with the GB channel. Stomach 9 is used to remove obstructions from the head and subdue rebellious chi. This function is due to its nature of window of heaven point, as these points regulate the ascending and descending of chi to and from the head. Stomach 9 is therefore often used in excess pattern characterized by excess chi on the top part of the body. It also dissipates nodules with such symptoms as adenitis, nodules of the vocal cords, and swelling of the thyroid. According to chapter 33 of the spiritual axis, this point is a point of the sea of chi together with Ren 17, Do 15, Do 14. It can therefore be used to tonify chi, although it is more often used to regulate chi and eliminate imbalances in the distribution of chi, resulting in excess above and deficiency below. Summary, it is used to remove obstruction from the head and to subdue rebellious chi. Stomach 9 is often used in excess pattern characterized by excess qi on the top part of the body. It dissipates nodules with such symptoms as adenitis, nodules on vocal cords, and swelling of the thyroid. Point of the C of qi used to regulate qi and eliminate imbalances in the distribution of qi, resulting in excess above and deficiency below. Stomach 9 is also known by its alternative name, Heaven's 5 Meetings. It is one of the 5 points known as window of heaven, literally 5 regions of the window of heaven. Point in the spiritual pivot which states headache due to rebellion of yang, fullness of the chest with difficulty in breathing. Choose stomach 9. Located in the pivotal neck region, stomach 9 dramatically illustrates the characteristic ability of this group of points to re-establish harmony in the flow of qi between the body and the head. The rebellion of qi, which arises when the qi in the lower region is disordered and chaotic, may manifest in various ways. In the head, it gives rise to headache, dizziness, and redness of the face. In the neck region, it stagnates, giving rise to scrofula and goiter. In the middle and upper jaw, it endures the normal descent of stomach and lung qi and gives rise to vomiting, sudden thermal disorders, wheezing, asthma, and fullness of the chest. According to Zhu Shihong documentary on the above passage from the spiritual pivot, the condition known as inversion qi, disordered, chaotic, and rebellious qi underlies the clinical manifestation of all the points of the window of heaven. One of the manifestations of inversion qi is sudden acute pain, and this echoes the important modern use of stomach 9 for acute lumbar sprain, as well as sprain and severe pain in any region of the body. The ability of stomach 9 to reorder rebellion and upsurge of qi also explains its strong action in reducing hypertension. According to the chapter Discourse on the C of the Spiritual Pivot, stomach 9 along with Ren 17, Do 15, Do 14 is a point of this C of qi. This passage gives the following indications of insufficiency and excess of the C of qi. When the C of qi is in excess, there is fullness in the chest, urgent breathing, and red complexion. When the C of qi is insufficient, there is scanty energy, insufficient for speech. Dual and overlapping properties of stomach 9 as a point of C of qi and a point of the window of heaven underline its importance in harmonizing and redistributing disordered qi in the body. As long ago as the window emperor's inner classic, observation and palpation of the pulse at stomach 9 was considered an important diagnostic method. The essential question in discussing obstructed urination describes a pattern of heat in the body like charcoal. The neck and chest are obstructed as if separated. A restless and abundant pulse at stomach 9 and dyspnea with counterflow qi. Elsewhere in the essential question grid, diagnostic significance is ascribed to the relative strengths of the pulses at the wrist and at stomach 9, while Samsung Jing refers to the 3 methods of pulse diagnosis: stomach 9 in the upper, the wrist pulse in the middle, and stomach 42 in the lower. Because of the complications inherent in this method, they were abandoned relatively early in the history of Chinese medicine in favor of focusing on the wrist pulse. Thank you for your attention.
Let us now discuss the 6 stages, still under common cold and influenza. The symptomatology of wind cold was discussed by Zhang Chongqing in the discussion of cold-induced diseases, Shanghan Lun, where he first elaborated the theory of the 6 stages. These are as follows. Greater Yang, so we have wind cold with prevalence of cold, wind cold with prevalence of wind. Bright Yang, so under Bright Yang, we have the channel pattern, which is manifested as stomach heat. Then the organ pattern manifested as stomach fire. Then we have the lesser Yang, greater Yin, lesser Yin, and the terminal Yin. The first stage, greater Yang, is the only exterior one. At this stage, wind cold is on the exterior and only the lungs' defensive qi portion is affected, not the interior. The lungs' diffusing and descending of qi is impaired, and the external wind is lodged in the space between skin and muscles, impairing the circulation of defensive qi. The essential symptoms of the greater Yang stage are aversion to cold and shivering, occipital headache and/or stiff neck, floating pulse. Aversion to cold indicates the typical subjective cold feeling and shivering that comes on as a wave in the beginning stages of a cold or influenza. It is characteristic insofar as it is not relieved by covering oneself. Most people who experience a bad cold or flu shiver even in bed under the blankets. Fever is due to the fight between the external wind and the upright qi. Please note that fever does not necessarily indicate a raised temperature, but it refers to the objective hot feeling of the patient on touch by the doctor, especially forehead and dorsum of the hands. The occipital headache or stiffness is due to the obstruction of defensive qi circulation in the greater Yang channels, which include the small intestine and bladder, which flow in that area. The floating pulse reflects the rushing of defensive qi towards the exterior to fight the pathogenic factor. Besides these 4 cardinal symptoms, there are many others, such as runny nose, sneezing, a cough, body aches, itchy throat. All these are due to the impairment of the diffusing and descending of qi by the lungs and by the obstruction to the circulation of defensive qi in the muscles. Thank you so much for listening.